question. I noticed my son went to the hospital, and we have private insurance, and we noticed you're at a disadvantage to have private insurance in the hospital because he had to be discharged in so many days, whereas other kids could stay much longer, and he needed to be there longer. We couldn't apply for it because we're not eligible, and we just noticed this. Is there going to be anything to catch these people that are sort of caught? You know, basically, it's terrible to have private insurance in this situation.
I think it's something that we are, that we're aware of. It's something that we see some opportunities with what's changing with the Affordable Care Act, honestly, and some of the changes to mental health coverage through what's required as the essential benefits, like plans are unrolling. I don't know that we have all the answers yet, but one of the other things that I'm going to do for the next year, as part of the Medicaid expansion bill, they put a group of us on a work group that's supposed to study healthcare costs and quality as a result of all these changes. And what other states are doing is an all claims payer database, right? So they're looking at things like, if you knew community to community how much it costs to, get surgery, get a transplant, get your appendix out, whatever, you might make decisions about where to go in different ways. And what we're seeing in a lot of hospitals are really, people feel like really financially driven decisions about length of stay, about treatment. And we're going to be studying it for the next year. And I'm hopeful that, again, this is another place that we can just use the bright spotlight of that committee's work to show where these gaps are and to encourage people to have different policies.
One thing that occurs to me, too, this is a bit like putting an earring on a pig. But in our family-to-family class, for example, we really try to teach resiliency skills. And boy, and those of you who deal with this, some of the parents and some of the care providers, they really know how the system works, how to game it, the good ones, and just on that, that comes up in our family-to-family a lot, and we say, well, do you know how to do the appeal process with the insurance company? And so, these are all, like I said, not addressing the root cause or the core issue, but they are some things that can be done to